Hi, and welcome to this week's video podcast. I'm Brent Dodge, and I have with me Josie Sweeney, a doctor of physical therapy at Alpine, who is also program director for the Oncology Rehabilitation program. Josie, I just want to help our viewers understand, what is oncology rehabilitation?
So oncology rehab is for individuals undergoing or recovering from cancer and cancer treatment. It's an individualized program where we assess their physical function, strength, endurance, flexibility, aerobic capacity. And then we take those findings and their detailed medical history and create an individualized safe plan for them to restore their function and return to their daily activities.
Well, it sounds like quite a novel program. Do you know of others in Missoula that are going on? Because I certainly haven't heard of anything like that.
No, there's not specific physical therapy for reaching out for oncology rehab. Yes, some patients after go and receive treatment, but we're trying to branch that gap from patients being a patient with cancer to a cancer survivor, getting them back to those daily activities that sometimes are a little challenging after treatments.
So that may help answer the question, why would a person need to go to physical therapy when he or she is dealing with cancer?
So when individuals first hear the word cancer, the first priority is treating the disease. But in treating the disease, that involves surgery, chemotherapy, radiation, and all of those can have significant side effects, short-term and long-term problems later on in life. So what we're trying to do is assist those patients in treating those and educating them about those side effects and letting them know that there are ways to reduce the side effects and restore optimal physical function.
Well, it's crazy to think that exercise would be something that these people would be thinking about. Tell me about the benefits of exercise at a time like that in life.
It can be challenging. A lot of people are nervous about doing exercise and unsure if it's safe, but tons of research is coming out in the last couple of years about the fact that it is safe and it is beneficial in restoring strength, improving physical function as a whole, and can also reduce fatigue, which is a big factor for cancer survivors. And just overall improving their quality of life and getting back to their goals of whether they want to run a marathon in 2 years or just taking out the garbage. Any of those specific goals are what we're focusing our treatment on.
Well, you've clearly worked with a lot of people going through something like that in their life, and I'm sure you've seen the impact of a therapy program involving exercise. Is that true? And what does that look like?
Yeah, it's amazing. It's great to see patients come into this and have a little bit of nervousness or concerns, and then just giving them the confidence and restoring their self-esteem with their physical function where they're at, and giving them and educating them on the gradual steps that they can take to get to those higher goals and higher steps of their life.
You have a background specifically working with individuals that are battling cancer. Can you speak to that and maybe some of the educational training that you've undergone?
Mm-hmm. So I am certified cancer exercise specialist. I received my training from Rocky Mountain Cancer Rehabilitation Institute in Colorado in 2011. So during that time, I had the opportunity to take a course where we learned about all types of cancer, all stages, the treatments that they go through to treat cancer, and also the side effects that those treatments involve for patients. We also covered the exercise aspect, going into detail about the research behind exercise and the benefits that there are for cancer survivors when they incorporate exercise into their daily life. So while working at RMCRI, I had the opportunity to work one-on-one with patients to develop those individualized programs to help them gradually get back to independent fitness programs.
Well, you're obviously passionate about this and have a solid background in helping individuals like that. I just wonder, with all that's going on with Breast Cancer Awareness Month coming up, can you speak to how this program can impact and help those folks?
Yeah, so we're doing a lot of outreach in October to let them know about the service that we're offering. Our oncology rehab team has a ton of experience, and we want to share that and get the word out, help them in those stages of recovery, no matter what stage they're in. If they're still in treatment or if they're 10 years out, there's still side effects that they can be struggling with. So we're trying to bridge that gap at Alpine.
It's just really getting the word out there. Again, I mean, I'm not familiar with a formal program like this, and so to see it happen is just really exciting to think how people in our community are going to be impacted.
Yeah, we're very excited about having the chance to use October, since it is Breast Cancer Awareness Month, to set up several different outreach opportunities and just get involved in the community. There's a lot of events already, but we're hoping to add a few new, spice things up a little bit.
Well, you also have a close relationship with Fit to Fight, and we've done a number of podcasts with the folks from Fit to Fight and do a lot of collaboration with them. Can you kind of share maybe how they work together, maybe how they're different?
Yeah, so Fit to Fight is a local program that's for cancer survivors, empowering them to improve their quality of life through fitness and health. It's a group exercise setting, so it's been around since 2008. It's a great program. We've had a lot of success, and we're currently really branching out to expand the program. I'm the clinical director of that program right now. I would say it's different in the sense that with physical therapy and our oncology rehab team, it's more of a one-on-one basis, which a lot of patients need coming out of cancer treatment. So we give them that education and that foundation, and then the next stepping stone would be to join a community program like Fit to Fight to get back into the daily community activities they want to enjoy.
I've just been so excited about Fit to Fight, the fact that Sam Schmidt was kind of a co-developer of that program. She's at Alpine, and that the other portion that came from the Peak Health and Wellness Center. We have such a synergistic relationship. How do you envision the Peak Health and Wellness Center working as you're in that environment, how that can impact people favorably?
The Peak Health and Wellness Center is a great facility. It's so welcoming and warming, and with Fit to Fight, participants can go in there and not be nervous about the overwhelming feelings that come with a huge gym setting. Everybody's so welcoming and will help you with any of the machines, and with the oncology rehab team, we want to give them that education and foundation, and we have the opportunity to go into the gym and teach them how to correctly use the machines and use all the great facilities that they have there, as well as Fit to Fight. Fit to Fight is also located at the Peak Health and Wellness Center on Blue Mountain, so it's another great spot to continue working on your fitness and health.
Yeah, and with the rehab team for the oncology program, I know Jess Kehoe is there at South. You're at our South location on Blue Mountain Road in 93. I just wondered now with Antera Quiñones coming in and working from the north side, there may be some give and take, and I know she works with the lymphedema program, and we'll be highlighting that as well as in October with breast cancer awareness. I just think it's neat that you guys have diversified and maybe people can have access to and fro those clinics, so that's pretty exciting. How would a person know when to contact you and how?
So at any stage of whether they're currently starting cancer treatment or 10 years out, we treat them all, any types of cancer. They can contact us at any point. Our South Clinic is where Jess and I both are located out, but also our North Clinic with Antera. So our website has some great information. We just launched our new oncology rehab specialty page, and then just giving our clinic at Alpine South a call and asking questions.
You know, there's just so much going on this month with the unveiling of a brand new program with Program Director Josie Sweeney, the Oncology Rehabilitation Program. If you'd like more information, be sure to visit our website or call our clinics.